I'm Darren Mullins. I'm a medical oncologist at Prisma Health. I went to college at the University of Alabama and went to medical school in Birmingham at UAB. Made my way to Memphis, to the University of Tennessee College of Medicine there, and did my internal medicine residency, and then went to the University of Virginia in Charlottesville for my medical oncology fellowship. So medical oncology is a subspecialty of internal medicine that specializes in the medical treatment of cancer. So we see solid tumors, we see hematologic malignancies such as leukemia and lymphoma, and we do also take care of patients with certain benign blood conditions as well. But in general, think of medical oncology as cancer medicine. Well, I really started out in an internal medicine primary care track, and I really thought I would be suited for that. And that really kind of evolved into my wanting to be a medical oncologist, because there really are a lot of similarities in basic clinical patient care. The science and the challenges of oncology and frankly treating some very sick patients sometimes is something that I enjoyed, and it was an opportunity to help some people that really were in a position of needing that help. So there was still a lot of direct patient care, and in some ways you become their primary care provider for a certain length of time and for a certain condition. So that's really, I think, how I made my way to medical oncology from a primary care internal medicine background. When we're taking care of patients with malignancies, with cancer, certainly I want them to, I think it's important that they understand what we're recommending, because the treatments can be complex. So I think patient education from my standpoint is important. I want to give them a confidence level that we really do have treatments, especially now over the last decade, 2 decades. We really do have treatments that are much better than we had 25 or 30 years ago. They're more effective. We can offer some really good long-term results sometimes. So I want to inspire, if you will, in those patients, a confidence and a knowledge that there really is a lot we can do. I also want to educate them on their survivorship years afterwards. It's nice to be able to say that in this day and age, but there are survivorship years that patients get now, and I want them to focus on health maintenance. I want them to focus on their screening procedures, mammograms and colonoscopies, because it's a lot easier to tackle problems when we catch them very early. So I guess that's really my approach to trying to educate patients and trying to guide them in their course. But I'm a big college sports fan. My wife and I both are. So especially in the fall, but really year round, we enjoy that. We've enjoyed traveling a lot in the past. When somebody asks me that and I think about it, I think, I guess one of the most satisfying things or enjoyable things that I do is after a long day in clinic, I like to come home and be in the kitchen with my wife. And usually that means I'm sitting at the counter watching her cook, which means the meal is going to be a lot better. But probably one of my most enjoyable things is sitting there watching her in her element and just spending time with her. And then that translates into the family as a whole. But that's really where I find that I'm happiest. If you'd like to schedule an appointment at our clinic, talk to your primary care provider or your subspecialist or surgeon who has diagnosed a recent problem, and have them place a referral.